So let me welcome Dr. Prem to this session. Dr. Prem, as all of you know, Dr. Prem is a senior specialist. He works with Just Look as well as associated with Graceful Living, where they do some remarkable work with senior citizens. So without further ado, I will ask Dr. Prem to uh, start. Hi, Dr. Prem.
Yeah, hi, good morning. Yeah, good morning, everybody.
Good morning.
Today, we are going to be talking about aging and cancer. I think you might not all know, but Feb 4th is usually celebrated as the World Cancer Day. And of late, of course, there's always been the fact that cancer and aging go hand in hand. As you grow older, the chance of your getting cancer has obviously been seen to increase. And with that in perspective also, more and more, there is a thing which is known as geriatric oncology. So the role of us like elder care specialists in trying to help in treatment of older adults with cancer has also become more prominent. So why is that as you grow older, the chances, of course, of cancer increase? Now, it's been seen, of course, one of the biggest risk factors, unfortunately, for cancer is aging. So if you see the United States of America, almost more than 60% of the cancers are actually 65 years and above, and it is not very, very far in India as well. Now, even during the COVID times, unfortunately, a lot of times it became quite difficult for people to give the needed treatment or get the needed treatment because of course, the pandemic, and a lot of people could not meet. So the amount of cancers which might have actually got undetected or untreated was also quite a bit as far as the pandemic is concerned. Now, the cancer is not only something which affects the older adult, but it also affects to a great extent their families. Now, and cancer acts very differently as compared to a younger age group, as compared to older groups, because we have to make very different decisions. That's why the role of a geriatrician obviously comes as well. Now, we all know that health conditions like heart disease, then arthritis, blood pressure, they all obviously affect the cancer treatment. Now, another consideration, of course, would be that there are a lot of practical and emotional issues which are obviously there. Now, every older adult will have different challenges. So it's very important that communication with an older adult is important. Now, when it comes to older adults with cancer, age is again truly a number. So each older adult will have a different health and also independence. So as we are saying, aging process, as we all know, is complex. So every person will age at a different rate. Now, your actual age might not show the age as a number will not show actually what your physiological age is. Now, physical changes which are sort of there. For example, as you grow older, there could be an instability to do all your daily activities. So serious health conditions could be there like blood pressure, heart disease, lung disease. So these coexisting conditions or comorbid conditions are the ones which we have to treat as far as cancer is concerned. Now, another unfortunate thing, which is of course improving, is a lot of times only age that we call and say that no, just because people are old, they have cancer, maybe we shouldn't treat to a great extent. No, I don't feel that should be the case. If it's a 75-year-old who has cancer, but who can still sort of get out of it by treatment, then the treatment should be given depending upon how many more years of good quality of life they can actually have. Now, there are also emotional and practical concerns. One is maintenance of independence. Now, for example, a lot of older adults with cancer, they might be taking care of themselves. So cancer treatment will interfere with them while cooking, for them to cook or control their health and decisions. It might actually make it difficult for them to walk. So it might be very, very overwhelming. And if, especially when there are no family members, then there could be a feeling of social isolation also. Now, older people with cancer are less likely to have a support system because they might have relocated maybe to a new home, do not live close to a family, or sometimes they have to live purely close to near the cancer center because of that particular treatment for whatever temporary time. Now there could be feeling of depression, there could be feeling of anxiety. Then community resources, of course, are there, which can to an extent help. Now, always one of the most important things is patient and caregiver should share their concerns, and then of course the social worker can help. Now there are also spiritual concerns. Effective communication is very, very important, and sometimes it becomes very difficult for a person with cancer, especially if it feels like a ticking time bomb wherein you can see the date every day and you don't know till when a person with cancer will obviously survive. But then there have been a lot of survivors, and there have been a lot of survivors in the old age group as well. Then financial concerns. See, unfortunately, cancer treatment will not always come cheap, and there might be related costs. So having being dependent financially on others also gives that sense of not having independence. But at the same time, if there are resources, then it obviously helps. Then physical limitations. Now a lot of physical limitations, especially like ability to move. Then a social worker or a nurse might have to go ahead to see whether the ability to move is good or not. Then transportation. I think assessment to treatment is also very important. How far the hospital is it near or not? Especially for people with cancer, because even that comes in the financial part, how difficult or easy is to even reach the hospital. Then the care management is very important. Now in this, first of all, you have to seek help. Now, not always an older adult with cancer is told by their kin also that they actually have cancer, but they have every right to know, and observing that news itself becomes very, very difficult. Then always communicate everything with the healthcare team, whatever issues are having, because it's a partnership. I mean, you have to tell whatever is happening in your mind, whether it's about finances, whether it's about practical issues. Then one has to be prepared with a list of questions. Get yourself obviously organized, because it helps in people with cancer treatment. So for example, a monthly chart with appointments, copies of the tests, current list of medications. Then transportation, yes, and planning up for your follow-up care. Now it's important that you update your legal medical documents as well. Now, as far as what questions one should ask maybe to the doctor after a cancer diagnosis is, what is the exact type of cancer, how is it going to be diagnosed, what tests should I do, what is this showing, do I need more tests, then what stage of the cancer it is, what does that mean, what are my treatment options, then which treatment option do you recommend and why. I mean, the reason being, one needs to know what treatment you will undergo. Chemotherapy or whatever also has its side effects. Then who will be part of the healthcare team? For example, if it's an older adult, then a geriatrician should be involved. And where there is going to be a physiotherapist is going to be involved, whether a counselor is going to be involved. Then what are the possible side effects, short term and long term? And most oncologists and their team tell it in detail. Now, if I'm worried about managing the costs, then who is going to help me? There is help as well. There are plenty of organizations which usually help. Then what are the next steps and what support services are there? I think that is also something which is very important, support services for your mental health as well. Now, usually a health assessment will obviously be done to see what are your coexisting medical issues, and a physical examination, then seeing what your functional status is. It's important that what all you can do, how independent you are, what are the medications you're having. Now, the thing is, to make treatment choices, we need to know what is the cognitive ability of the older adult as well, because some might have dementia, so they might not be the decision makers as far as treatment is concerned. Then vision, I think, is very important. It could be because of vision problems from before, or it could be because of chemotherapy. Now, if somebody has visual problems before and they have maybe fatigue or dizziness due to chemotherapy, it can increase the chance of falling. Then hearing is something also which is very important. Then difficulty in walking and balance. What is the nutrition? I think one of the biggest things in cancer treatment usually is nutrition. Uh, then emotional status, I think, is very, very important. Whether there is any depression, anxiety, are you able to carry out your own bowel and bladder? So that is important, because sometimes tumors which affect your spinal cord can cause both of it not being under your control. Then social support, I think, is very, very important. And treatment preferences. Everybody is offered treatment preferences, and everybody has a chance that they can sort of choose whatever is best, whether they want to go aggressive or not. Now, cancer treatment also has lot of goals for us. So one is getting rid of the cancer. Second is helping the person to live longer. Third is, of course, reducing any signs and symptoms which are related to cancer. And ultimately, it will be maintaining the physical and emotional abilities to a person's quality of life. I think that is very, very important. Now, as far as the treatment options are concerned, which is always depend upon what the type of cancer is, the extent to it is spread, what are the available treatment options, what are the risks and benefits, then what is the assessment shows, then what will the treatment actually have on your physical, emotional, social well-being, then what are the emotional well-being factors, what are the financial limitations. Now options are many. Yes, there is surgery, sometimes maybe surgery has to be done. Then heart function assessment is very important, kidney function is important, liver function and lung function is important. Now after surgery, you might, or with surgery, you might actually have to have chemotherapy plus minus depending upon your the stage or the type of cancer. Then another important thing is standard treatment. What is the palliative support if you need, what is the home care which might be needed, because everything is now available. Then of course there is, if at all, radiation treatment, then chemotherapy and its side effects. Now what is the quality of life, what is the physical comfort, where is, what about your nutrition, what about your relationships, financial security, all these things matter as far as your treatment is concerned. Now the concerns you obviously will have, which you have to ask, is what is my chance of, I mean, recovery, and how many times will I have to take it, because these are all very, very important questions. Now another important thing is, I think, prevention of cancer as well. In fact, the World Cancer Day this time, one of the themes, of course, is closing the gap. So basically, to try and tell people more and more about cancer and help them to bridge the gap between actually diagnosing and taking the treatment, because a lot of times diagnosis does not happen. So I think screening is very, very important. So as you get older, screening for cancer is very important. Now, what all should you screen? So usually in females, especially if there is a family history of carcinoma of the breast or breast cancer, then definitely your mammography should be done at least once yearly. If no, then of course, depending upon, you can do it once yearly anyways. And after a certain amount of age, late after 70s, we don't usually do, because we do not see that there is an increased chance of see a breast. Then another important thing is, in all your health checkups, yearly health checkups, a pap smear is also usually done, because that also helps in knowing of the cervical cancer. Then if there is any family history of cancer of the colon, which is basically the cancer of the intestine, then also colonoscopy usually is also done, but it will be decided depending upon, of course, what you're having. Then things like hemoglobin give us a good idea whether there is actually a chance of cancer. If there is a loss of weight, loss of appetite, these are things which one should look forward to. Then one of the important things which are there in males, of course, is prostate cancer. So PSA, that is usually done to see that. And two things which are very important in any health checkup is, one is a gynecological examination for sure for females, because that is when sometimes discovery happens, which people might thought that this is normal. I mean, there have been chances that people have just discovered breast lumps after years, just thinking that it is nothing. So it is very important that one educates oneself about what type of things can be risked. Then another very important thing is, of course, is a surgical examination as far as males are concerned, especially for prostate examination, because depending upon that, of course, we'll be able to know. Then usually an ultrasound abdomen is also done yearly. Then cancer markers need not be done yearly. It depends upon the risk factors. But these are certain screenings which one should do, especially one after, if somebody is after 50 plus. If you have a family history of cancer, then the risk of cancer increases. So one has to be in through the health checkup, actually just do the parameters and see. And yes, in the health checkup, one of the significant things that I do with older adults is a thorough physical examination also, because sometimes you tend to miss. A lot of things are very similar. For example, you will have loss of weight, loss of appetite with tuberculosis also. But at the same time, with cancer also, you will have the same symptoms. So one has to be very, very careful in an examination to understand what kind of cancer is there. Then the gynecological examination is also important, because a lot of times there is a prolapse, which could be through the vagina, it could be through the rectum, and the older adult does not realize it, purely because they just feel something is coming out. And there have been a lot of cases where a thorough gynecological examination has actually helped. So I think it's very, very important that if at all there is there is sort of any issues, one should see. But sometimes screening helps, because with cancer, it's like with every disease, the earlier it is screened, the better it is. And to actually know earlier, I mean, a lot of people have been treated of their cancers also, and the types of cancers are varied. It could be the blood malignancies, it could be of the various organs in our body. It all depends upon a thorough lifestyle. I mean, things like having a good sleep, having a good diet, not having a very salt heavy diet, not having red meat. Usually red meat, there is a more risk factor. Then having adequate amount of water, then having I mean, you can say, I mean, most older adults don't have fast food anyways. Then having a control of your diet, not having too spicy, not having too sugary, and not having too salty, not having too much of oil. So all these things are also very important as far as cancer preponderance is concerned. Then behavior, as far as smoking and drinking is concerned, both are pretty much risk factors. So they should also be sort of taken into consideration. Then it depends upon suspicion. And then once you actually have it, and then you should know what you can or what you cannot have. For example, the questions whether I have cancer and what will be my survival and whether I'll be able to lead a normal life is a difficult one to answer. It depends upon what kind of cancer you actually might have. And depending upon what we discover, what the spread is, sometimes the cancer can be only to the organ and not spread to the body. So the more the away the spread is throughout the body, then the more difficult obviously it gets. And then, I mean, there can be a lot of questions as far as end of life is also concerned. So that is something you will have to ask, and we will be able to answer it. So this was overall about cancer and aging. One of the very important things is, it's not that all older adults will have cancer, but at the same time, there is a distinct risk factor that as you grow older, there is definitely more chances of cancer. And it's not that treatment is not possible. Treatment has been possible, and people are living longer also after the treatment of the cancer. So thank you. Thanks a lot for your patience.
Thank you very much, Doctor. I'm going to allow maybe maximum 2 or 3 questions, as we need to end this as the doctor has another appointment. So if anybody has any questions, please unmute yourself, ask your question, and then mute yourself again. Any questions?
Doc, can I ask you a question? Hello.
Yes, Norinati.
You mentioned that after the age of 70, you can ignore something called breast cancer. Up to the age of 70, you keep checking whether you have a lump. So after 70, you can take it easy?
No, I didn't say ignore. I would say usually after 70, depending upon the fact that if you don't have any lump or if you don't have any symptoms, then you might not need to do the yearly screening. You might actually have to be in touch with your doctor, and depending upon that, you might have to screen, because as the age increases, sudden discovery of breast cancer has not been seen in later age. But if there is a family history, there is still a sort of a chance. For example, if there is a family history, then everybody in the family, even the youngsters, need to do the screening at a very earlier age, purely because the gene itself, the cancer gene, might be really prominent, and there might be a chance. I mean, it might miss generations also, but at the same time, if there is a family history of cancer, especially breast cancer, there is a greater chance. So there have been, in fact, there have been people in the West who actually have done their mastectomy before itself. It's just to reduce the risk, because they know it's such a strong gene. And of course, genetic analysis has been done, because rather than waiting to have it and then sort of treating it, they have actually just gone ahead and done mastectomy as well. I know it is not easier said than done, because it's obviously a distinct change in the body of a female. But yes, people have done that also, because ultimately longevity is more important. So I think it's not that you should neglect it, but have those leading questions in your mind as well. But the chances of screening, I mean, that gap in screening is something which we increase depending upon the person. After 70, we don't say that, no, you should every year for compulsory, you should do. But before that, we say it because the chances are more of getting.
Okay, that's clear. Thank you so much.
Yeah.
Any other questions? We have time for one more.
Hello.
Yes.
Hello. Can you hear me?
Yes.
Hello?
Yes. Yeah. Please go.
Can I ask you something? What about the vaginal, this thing that you said? How do we find out about that?
So usually, ma'am, it's always pap smear. A pap smear is always done. I mean, it's usually done in yearly health checkups as well. And that maximum will just show atrophic vaginitis, which is usually, as you grow older, the atrophy of the vagina will actually happen of those cells. But the reason we say is we shouldn't miss, because without doing the pap smear, you'll never know about CA cervix until unless you're having frank bleeding and you're having, I mean, sometimes it becomes so bad that you might actually have a prolapse as well. So that's why we do an yearly pap smear, just to know that, yeah, we know that there is age related changes, but nothing apart from that. And the preponderance is also seen. For example, CA cervix is something which is seen in different age groups. Another cancer which I just forgot to mention is CA ovary also. So that is also really prominent in one of the gynecological cancers. But again, that's why I said a thorough gynecological examination is also very, very important. Something very much neglected. The reason being, gynecological examination has nothing to do with reproductive age. A gynecological examination should happen for everybody for a female during different stages of life. It doesn't mean that it shouldn't be done after after what you call the reproductive age, just because the hormones are not there or just because there is no chance of pregnancy. So I think that is something which I would want to stress on, because most older adults themselves say what is the need, but that is not the case. A lot of things have been discovered by doing it rather than neglecting.
Doctor, if your pap smear checkups are okay, everything is fine, but still there is a little irritation in the vagina, then what is that due to?
That could be purely because of atrophic vaginitis, and sometimes certain gels help, hormone specific gels help, which you just put and you're fine.
Doctor, I know that we are running out of time. Do you have time for one more, or should we end right now?
I think we'll have to end now, because I have to join into another one. Yeah.
Thank you very much, Doctor. This has been very, very helpful. We look forward to seeing you again soon. Thank you, everybody, for logging in. Thank you. In case anybody wants to talk to the doctor for his professional consultation, do contact us at TAARE, and I will give you his contact details. Thank you.
Thank you, Doctor. Thank you, Saleh.